Now, the guidelines supporting ongoing national surveillance and evaluation of effectively reduced sodium levels, commonly known as SALT, in a sustainable and impactful manner has been unveiled by the federal government. Minister of State for Health and Social Welfare, Dr. Isaac Adekunle Salako, during lunch program in Abuja, informed that the sodium reduction guidelines was developed through extensive research by the Nigeria Sodium Study Team at the University of Abuja, in collaboration with the National Technical Working Group on Sodium Reduction and other partners. Let's join Elizabeth Kasham for more.
The minister, who was represented at the launch by Director of Food and Drug Services, Pharmacist Olubumi Arigbena, noted that research shows the average salt intake in Nigeria significantly exceeds the World Health Organization's recommended daily limit of 5 grams, with many communities consuming between 7 and 9 grams. She emphasized that this excessive salt consumption is strongly linked to the alarming increase in hypertension, which now affects over 35% of adults in the country.
Mandatory maximum sodium targets. We have established clear limits for sodium content in processed and packaged food, guided by scientific evidence and aligned with global best practices, with the support of the World Health Organization.
Principal Advisor, Resolve to Save Lives Nigeria, Mrs. Okioma Obasi, stressed that non-communicable diseases continue to be the primary cause of death globally and responsible for 75% of deaths not related to pandemic worldwide.
Cardiovascular diseases claim lives of at least 19 million annually globally, making them the leading cause of NCDs. The development of a national sodium reduction guideline by the Federal Ministry of Health and Social Welfare is indeed highly commendable.
An Executive Director, Corporate Accountability and Public Participation, Africa, CAPA, Mr. Akimbode Oluwafemi, stated that properly implementing the guideline will significantly help in reducing excessive sodium consumption and lowering the incidence of cardiovascular and non-communicable diseases in Nigeria.
We reiterate our call on the ministry for the effective implementation of these policies, including the regulation on TFAs, which was another major milestone by the country.
Country representative of World Health Organization, Dr. Pinda Wakawa, during the event, pledged the agency's support to ensure food security across all member nations.
If the WHO recommended policies were implemented, we will see sodium consumption reduced by over 20%, getting close to the target set in 2013. This government-led, multi-pronged population salt reduction guideline will require the commitment and participation of all stakeholders.
The launch of the guideline marks the beginning of a unified national campaign to mitigate the health risks linked to high sodium consumption as government agencies, key industry players work together to ensure implementing the provisions of these guidelines. Elizabeth Kasham, ASO Television News.